So I'm going to be talking about the definitions and comorbidities and diagnostic challenges. I'm at Atlantic City Hospital. I'm a children's psychiatry expert. So I would like to reiterate the title of my presentation, Understanding Digital Addiction, Definitions, Comorbidities, and Diagnostics. So the presentation will include a short introduction and then follow up with how can we make diagnosis and what are the comorbidities and some difficulties in definitions. So while technological advancements make our lives easier and offer various opportunities for children and adolescents, they also have some risks involved, especially children's interaction with specific electronic devices. For children and also for teenagers, have decreased cognitive skills, impact on physical health, and effect on mental health. For instance, obesity linked to sedentary life, and also blue light is another issue that have some link with sleep disorders, and also adherence is important. Addiction is important. What is addiction? It is the inability to control the use of a substance or the engagement in a behavior despite negative consequences. And behavioral addictions develop through repetitive and rewarding behaviors that do not involve the use of substances. Examples that can include, for instance, gambling, shopping, sex, eating, and internet use. So Griffiths said the behavioral addiction model is as follows. He did the stories. According to Griffiths, whether behavior to be an addiction, there should be a lot of importance given to that in the life of a person. Salience, mood modification, tolerance, withdrawal, conflict, and relapse are the reasons for a behavior to become an addiction. So addictions associated with excessive use of digital technologies have become a major concern since the 1990s. However, at the time, the phenomenon was defined solely as internet addiction and was explained by Young based on the diagnostic criteria for gambling. And after that, as digital devices and activities increased, the concept evolved into the broader term of digital addiction. And despite its growing popularity in the literature, it has not yet been included in the DSM or ICD. In 2020, the WHO officially recognized addiction to digital technologies and connected devices as a global use. And it has been reported that in order to actually, before introducing further with the presentation, we have to give some definitions. What is digital device? So they are the electronic tools that process and deliver information digitally. What are those? Like smartphones and computers. And for instance, digital platforms are also online service environments where users access and interact with digital content such as YouTube, Google, and Netflix. And what is digital media? All visual, audio, or written content created and shared in digital environments, online video, blogs, and podcasts. And digital technologies are all software, hardware, and infrastructure systems that process digital data, AI, virtual reality, and so on. So after the definitions, what is digital addiction? Digital addiction is considered a new type of behavioral addiction and impulse control disorder involving the excessive, uncontrolled, and compulsive use of digital devices, media platforms, and technologies. Studies use various terms like technology, internet, and computer addiction. However, DA is a broader concept that includes subtypes such as internet, gaming, and social media addiction. It does not necessarily require internet use. It's a general concept, and it also includes offline activities involving digital devices, such as offline games. And no, internet usage is not a condition, as I said, so offline games are also part of those. So there's still no consensus on the reality definition or diagnostic criteria of DA. Even the terminology used to define a DA remains unclear. Nevertheless, health organizations have become to recognize that certain patterns of digital technology use may indicate for instance, there are some cases when there's a further research is needed. Disorders due to addictive behaviors in ICD-11, for instance, gaming disorders is listed, and internet gaming disorder (IGD), which requires a further study. So gambling disorder on or offline, other specified disorders due to addictive behaviors, and disorders due to addictive behaviors unspecified are the categories you see here that we can also mention. For instance, people trying to quit but cannot succeed, that this lying to themselves and usage of internet giving them comfort. So all these criteria must be there in ICD-11, the International Classification of Diseases. So it should be characterized by a pattern of persistent or recurrent gaming behavior, which may be online or offline, manifested by the following. So impaired control over gaming, for instance, the intensity, duration, termination, or context. Increasing priority given to gaming to the extent that gaming takes precedence over other life interests and daily activities, and continuation or escalation of gaming despite the occurrence of negative consequences. This pattern results in significant impairment in personal, family, social, educational, occupational, or other important areas of functioning. So, what is important here is in DSM-5, internet gaming disorders, 5 criteria should be there out of the 9. For the gambling, it is this 9 drops to 5, and for substance, from 11 to 5. So it means that internet gaming disorder drops to 5 criteria. So how do we do the diagnosis? How do we make a diagnosis? For the DSM-5, the scales are also developed according to this. Although not yet officially validated, IGD criteria can be applied to non-gaming behaviors like social media, depending on the individual's digital habits. And also, as there is the ICD-11, other specified disorders due to addictive behaviors criteria, that these can also be used for the diagnosis. So, as I just mentioned, one ongoing debate centers around the terminology used to define a digital addiction. And it is argued that individuals become addicted to specific content, so terms should reflect particular online or offline. So the situations that are linked to the usage of internet actually comes up with an addiction in that sense. And internet is an access actually to this digitalization. So we think that using internet dependency is not an accurate terminology. For instance, for the tobacco is the lighter is used to light the cigarette and then contributes to the cigarette addiction. So it is kind of a similar scenario. So social media addiction, Instagram addiction, YouTube addiction, video game addiction, online pornography addiction, PUBG addiction, etc. So, as an umbrella terminology, we can talk about technology addiction or digital addiction are deemed to be suitable as the terminology to be used. So, there's a study for defining digital addiction, there are some key features from the literature. What sort of digital criteria are there for digital addiction? We should also attract attention, pay attention to, for instance, no clear objective whilst on device, over attachment to device, continuing despite negative outcomes, unsuccessful attempts to control use, compulsive or impulsive use. These are actually factors that are contributing to non-functionality of the individual. So there's also this context that we should keep on into consideration.
Because the definition is not actually clear. In order to ease the process, we actually check out the reliability scales. They can be used. First one of these is the digital addiction scale for children. It was tested on 9 to 14 years old children. Again, DSM-5 diagnostic criteria, which there are 9, with over focusing. The most important thing is to use my digital device kind of responses were taken. And also digital addiction scale for teenagers. It was tested on 9 to 15 years old children. It has 10 items rated on a 7-point Likert scale with higher scores indicating higher level of DA. It was about mood changes. A lot of comorbidity is actually coming with these disorders, and it should be evaluated on each patient. It's like depressive disorders, attention deficit, hyperactivity disorder, sleep disorders, eating disorders, autism spectrum disorder, behavioral problems, self-injury, suicidal thoughts, and other behavioral addictions are mostly existent. In order to, is it reasonable? It's not like it's mostly feeding each other. If a young person that has digital addiction is kind of more possible to get mental health issues and psychiatric disorders, it actually feeds itself. It's kind of a loop. There are some new syndromes that are actually coming up while digital exposure increases. One of them is the electronic screen syndrome. It's about disorder of dysregulation due to chronic hyperarousal. It is an dysregulation problem. They have hard time sleeping and focusing. It's emotional dysregulation, weak motor skills. It's like hyperactivity disorders and mood control disorders. We are thinking about if we diagnose less than it is needed, focus problems could arouse, then we can think about this. And another diagnosis is post-digital nannying autism syndrome. In the early ages, it could cause effects similar to autism. When they are awake, if they are exposed to digital devices more than 50% of the day, it could develop autism-like symptoms. It's like diagnosing autism, but the basic difference is if you remove the digital devices completely and if you pay attention to the children, it could actually recover very fast. In the third part, diagnostic challenges. Here, Usage of technology is mandatory. How we eat in our daily life, we take care of ourselves, especially for the children that are born into the digital age. It's a must. It has benefits and disadvantages. In some schools, you must use iPads, and some of the kindergartens too, in order to complete the homeworks. People supposed to use computers last 5 minutes, by the way. Pathological usage and adaptive usage has a difference. We have to differentiate it, but it's hard. What kind of benefits are there? Everybody could read those. I will move a bit fast. We have two hypotheses about digital technology use. Stimulation hypothesis, which is about appropriate digital use may stimulate cognitive and social development, like supporting development of new skills or facilitates fast access to information and helps maintaining existing friendships. So if you use it accordingly, it could have a stimulation effect. And then displacement hypothesis, the hypothesis that the time spent using technology may cause harm by displacing more valuable activities in proportion to exposure. Well, before diagnosing, we should make a differentiation between healthy usage and harmful usage. If the use impairs or harms an individual's daily functioning, it may be considered an addiction. Well, we sometimes think that they are using a lot. It may be a criteria in addiction, but the duration of usage actually depends on the individual's capacity. When we are diagnosing, checking out the screen time could be misleading. In traditional methods, like we can check out the screen time, but it's not reliable exactly. We need some objective technology-based observation methods to observe the digital usage of that individual, because it is correct if we can reach out to those data. And last but not least, there is a relationship between the need in monotonic relationship means that as one will increases, the other consistently increases or decreases. It's like the U-shaped relationship, and that relationship suggests that not a lot and not too less. In technological usage, there are no monotonic relationship. If you use a lot, we can be harmed a lot. Understanding is not exactly true. It's like Goldilocks effect. It's too cold, just right, and too hot, just right is good. And technology usage is all about this. And there is an optimal usage, not limiting all the way is not actually meaningful. There are some studies supporting that idea. The people who play game less than 1 hour has a positive effect. Of course, if you extend that time, negative features arousing. It is also same in social media usage and depression relationship. When you enter into the social media, you can see a U shape there. There could be an optimal usage, but if you extend that time of usage, it will increase those depression samples. But 1 hour is adequate. We shouldn't evaluate it solely based on screen time. Daily function disruptions and psychological conclusions should be evaluated. And Why children use the technology is important. Which screens do they use? Which medias that do they enter? Do they create content? Not only duration of usage is meaningful. Digital addictions are associated with psychological and social comorbidities. And we have some red flags such as academic failure, sleep disturbances, and changes in real life relationships should to be carefully observed. And if a decision making process needed in this means we have to have diagnostic criteria. During the evaluation, during the assessment, which kind of content was consumed is important, and the effects of the mental health was included. Observing such things are important, especially in the 21st century workforce, and accessing information is needed, and it is also needed to keep friendships going. It has to have a balance between benefits and harms. And lastly, there's a documentary called The Social Dilemma, which we took a quote from there. If you are not paying for the product, then you are the product. It's a really astonishing quote. Thank you for listening to me.